In the late 1990s, the HIV/AIDS crisis was raging in developing countries, even though life-saving treatments were available in wealthy parts of the world. We were frustrated seeing our patients die from treatable diseases because they couldn't access the treatment they needed, or because sometimes they needed treatments that just didn't exist yet. So, in 1999, we launched the Access campaign to speak out and advocate for access to medicines, vaccines, and diagnostics for the people we care for and beyond. Here is how we increased access to life-saving treatment over the past 20 years. We focused on prices. By encouraging the production of generic versions of life-saving drugs, we helped drive down prices. We worked to protect the space for more producers of affordable generic medicines. And we fought hard to challenge the high prices that exclude many children from accessing life-saving vaccines. We also had to tackle the problem of drug availability to make sure we can get treatments to the most neglected patients. For example, we worked hard to bring medicines back into production that pharma corporations had abandoned, and we collaborated with partners to increase access to life-saving tuberculosis treatments. And finally, we have always focused on the patient. We have been pushing for a research agenda that's focused on people's needs, not corporate profits. Lastly, we elevated patients' voices to put a face to these diseases and to drive change. Today, many new medicines, vaccines, and diagnostics are still too expensive. Many are not even being developed at all because pharmaceutical corporations still prioritize profits over lives. And today, the high price of medicines is still a global problem, not just a problem of developing countries. So we'll continue to demand change in this system to ensure access to affordable, effective, and life-saving medicines for all. 20 years on, our slogan is still as relevant as ever. Medicines shouldn't be a luxury.